again, what I call medical information, not a medical education. You're not taught how to take care of people. I showed you upstairs what one of our kids did years ago, and I always say this to people. Write the word words, one after another, without any space, and you notice they become swords. So when we as physicians are not trained how to communicate, we're hypnotic in a negative way. You know, we're inducing trouble by, in a sense, protecting ourselves by telling you everything that can go wrong. I always say it's like the commercials on television. If they didn't start by telling you something is good for your headache, you see, and then they tell you, but you can become sterile, you know, have liver failure, you know, if you take this pill. But at least they started with, it may make your headache go away. But what we do is say, look, you know, your liver could fail, this guy, yeah. Why don't you tell me it might be good for me too? Yeah. And I put in one of my books on adriamycin, one of the chemotherapeutic agents, a paper that's handed to patients. The whole page is what can go wrong. It doesn't say this may help you live longer or cure your cancer. There's not one positive word on the whole damn page. And you hand that to somebody. And I used to tell patients, give it to your family member. So if you have an ache or a pain or something happen, you say, hey, is that on the list? No? Okay. If it is, they can tell you. Because one of the things, I always remember somebody in our group who had a lot of nausea after chemotherapy, but she didn't have her glasses on, so she got her daughter to bring her compazine, she told the daughter. Daughter hands her a pill. A few minutes later, she's fine. Many hours later, she says to her daughter, I'm feeling nausea again, get me another pill. Daughter hands her a pill. She said, what the hell are you doing? She had her glasses on now. She said, what do you mean? I'm giving you the same pill I gave you, 4 or 5 hours ago. This is my Coumadin, an anticoagulant. Daughter said, I'm sorry, Ma, it had a C on it. See? So, again, she believes, look what happens. And I always loved a story about Erickson, that he would sit in the office with a client and say, oh, just remembered something, I have to step out for a minute. He'd write a note and leave. What are you going to do? He'd peek at the chart. And he would write doing well and walk out of the room, say. And think about, oh, and you sit down, yeah. And doctors aren't taught that.
No.
That how your words can, as I say, kill or cure. I always say the words are swords. You can use a scalpel or you can use words. And I really began to pay attention to what I said to people, especially walking in the operating room. Say, anesthesiologist would say, you'll be going out. That could be scary if it's out of control. And I would say, hey, yeah, when was the last time you went out on a date? And suddenly it's, oh.
You reframed it.
Yeah. One of the best that we had, I laugh because, see, I always say, if you want to help people, be a child. I mean, see, that we're all multiple personalities, and I mean that literally. But if you're wounded, you're afraid of relationships and connections. Like that woman who said, failure, my parents committed suicide. She had no relationships. She said, I have a job, I learn people's names. That's where it ends. I don't want to get hurt again. And that's why, I mean, if I showed you her drawing, there's this sharp, masculine figure who, one of our kids saw it on my desk and said, boy, you hug her, you'll puncture yourself. I thought that was damn intuitive. This is a kid walking by your desk, but he could see this about her. But this woman was in total panic about surgery. And I spent a half an hour in the hallway outside the operating room trying to calm her down. I realized it's a waste of time. You're never going to accomplish anything. So we say, okay, we're going ahead. We wheel her in. You wheel her in the operating room, and she says, thank God all these wonderful people are going to take care of me. Okay. I thought, if I agree with her, it's not going to accomplish anything. So I bent over. I said to her, listen, I've worked with these people for years. I know them. They are not wonderful people. Well, for about 2 seconds, she looked like she was going to run out the door. And then she realized he's kidding. And she burst out laughing. And you cannot be afraid when you're laughing. You can't be. It doesn't, it's impossible.
You can't hold two
It's
spaces
impossible
at
to be
once.
fearful, if you're laughing. And plus, everybody else in the room heard it and starts laughing at my comment about them. And we became family, and it's a totally different experience for her. And I've also learned, as I said, that through the use of imagery, because when somebody hands me a horrible picture, Yes, I'm in the operating room. It's a black box. Nobody's there. I'd say, then maybe you shouldn't have surgery, or you need a different doctor. I mean, you have a lot of, but if you want to go ahead, why don't we 4 or 5 times a day visualize this as successful, recovering quickly, doing well. And literally, a week or two later, you say, draw a picture, and it's gorgeous. You're surrounded by, medical people, family, God's light shining in the window. It's a totally different experience. And I've learned the body doesn't know when you're not actually going through something. It's training. When you think about what athletes do, performers, you rehearse and practice. And that's the part I try to get across to people. You act and behave as if you're the person you want to be. And my crazy sense of humor is always, get a role model. So if you run into trouble, how should I behave? And WWLD, what would Lassie do? Say, because animals are complete, man is not. If they're depressed, I add, what would Lucy do? Though I'm learning, I was talking to a depressed teenager who was into drug addictions and things, and telling her I love her, and I said, what you need to do is what would Lucy? She doesn't know Lucy.
No,
I love
yeah.
Lucy. It wasn't her time. So I said, well, you got to go get and
Go
watch
get the
it.
I Love Lucy
But
videos.
that a graduate student down at the University of South Florida drew blood on 2 people, a man and a woman. He gave them a comedy, he gave them a tragedy. Okay? And when he drew their blood, in the comedy, immune function was up, stress hormone levels down. In the tragedy, immune function down, stress hormone levels up. So, when I heard that, I thought, wow, they're acting, and look what it's doing to them. What if it's my life, how this affects me? But that's also why I say to people, rehearse and practice. So criticism becomes feedback. It's not a negative, it improves you. You want your family, the people you work with and the people you work for, to criticize you. And I always say, the best doctors are criticized by family, patients, and nurses, because they know you're listening and willing to change. And I learned that. At first, I used to think I was the worst doctor in the whole hospital because everybody was telling me what I was doing wrong. Because I hadn't been in a bed. So they were telling me even simple things like, what's wrong? I mean, I walked in the room, and a woman said, what's wrong? I said, what are you talking about? She said, look at the expression on your face. I said, I am thinking about how to help you. She said, thinking the whole way. And smile when you can. But you see, those simple things, if you hadn't been a patient, you don't think about it. So, if I ran the medical profession, I wouldn't let anybody graduate from medical school without being a patient. Then you've lived the experience. Now you're a native, not a tourist. Those are words from a woman's poem. And we need to see everybody. And another poem, I'm a work in progress. Think of your patient and yourself as a blank canvas. So you're creating a work of art. And you don't discard it, if it doesn't look right or come out right. You keep reworking and retouching. And you don't see yourself as a failure. It's a constant process. And that's what I've learned with patients, to be there and to love them and to work with them. But when I've said to people, draw a picture, and they hand me a piece of paper, it says, my 10-year-old son Bobby did this because I'm not good at drawing. You're trying to get over cancer and you're worried. But I also realize that's why so few people who are willing to be, group members, because it's one more thing they could do wrong. See, if I don't exceed expectations. But the key word is potential. That's what I've taught people. And a wonderful line from Ernest Holmes, the founder of Science of Mind. What if Jesus was the only normal person who ever lived? When I read that, I thought he's grinning from ear to ear when he wrote it. But what a wonderful line when you talk about potential, see? And so how do you know what you're capable of? That's what I hold out to people. I tell them, you're not a statistic. It has nothing to do with it. If 1 out of 100 live, maybe it could be you. Let's find out what that one did. And again, what I found was everybody had a story. When they didn't die when they were supposed to, they all had a story. And it wasn't about avoiding death, if you know what I mean. The one I often talk about is a landscape gardener. Again, when do you get an ulcer? You retire. Turns out to be cancer. John said, I said to him, I need to get you right in the hospital. You've been living with this, because people thought it was a stress ulcer. He said, no, you forgot something. What? It's springtime. Going to go home, make the world beautiful, so if I die, I leave a beautiful world. A few weeks later, he shows up. Okay, go ahead. We operate. John, I can't cure you. You need treatment. No, you forgot something. What'd I forget? It's still springtime. He didn't show up again till 3 years later. I thought he was dead. See, when the nurse handed me his chart, I said, he's dead. You got two people with the same name. She said, open the door. I opened the door, and John is sitting there, and he said, I have a hernia from lifting boulders in my landscape business. He lived to 94 with no sign of cancer and became my teacher. And others too. But you see, the craziness is, you meet a mother of 9 who says, I can't die till they're all married and out of the house. You know when she dies? 20 years later when the kids leave home. So that's why I'm trying to help people be authentic. Another hypnotic aspect is for Mother Teresa. We would like you to come to an anti-war rally. No. And they all go, oh. But if you ever have a peace rally, call me. Oh. So I've written an article, waging a war. When you wage a war, you empower the enemy. But if you say, how can I find peace and heal myself in my life, that's totally different. And the other is, even with imagery, you go into a doctor who says, I'm going to kill your cancer. Dave said, I don't kill anything. I'm a Quaker, I'm a conscientious objector, and he walked out of the office.
Good for Dave.
Now, he didn't go home to die. He lived for over 12 years. But I've also learned, there are kids who are, because I was rereading my book, because of something you mentioned, the boy who had a brain tumor, and he had rocket ships blasting, and he says to his father, I can't find the tumor anymore. And the doctor says, that's impossible. He's going to die. We're not getting more CAT scans, But the kids running around the house, well, go back to school. He went back to school, fell in gym, hit his head. So he did get a CAT scan because they were worried about an injury, and there's no brain tumor. And the interesting thing was, he said, all I see are white spots, and that's what showed up on the scan, calcifications. Yeah, the tumor had died and was left with these calcifications, yeah. But, and I've had, more and more stories from people, from having birds eat bird seed to a whole host of things. Or a woman said, I have this, tumor in my chest, and I'm seeing like German shepherds or tigers or whatever eat it. And nothing was happening. And then one day she said, it's a block of ice, and God's light is going to melt it. What a change. So I use the word eliminate. How do you eliminate your cancer? So if some kid wants to blast the hell out of it, fine. And if somebody else wants to melt it, see, I don't have trouble with our dogs being my immune system. I mean, if they're roaming through my body, they're protecting me. So I don't see it as some vicious, creature. But it's important, I think, that each person find the right image for them, that we don't say to everybody we see, have Pac-Man, a German Shepherd, a tiger, or melt it. It has to be right. And when it happens for the person, then special things really begin to happen.